Why do babies and children need to be immunised? We're talking to Dr. Hugh at Tauranga Hospital.
We frequently have cases of whooping cough in hospital here, and even this year we had 2 children who were in intensive care at Starship with whooping cough, very severe.
There we go.
Well, the problem with whooping cough is that they have this paroxysmal cough and cough and cough and cough until they can't breathe, and then they go blue and become very unwell. It's a very distressing condition to watch, and the treatment once they have it is only supportive, so immunisation is by far the best way to protect.
Doctor, a target of 95% of all young children vaccinated by the end of the year.
Well, it's certainly an ambitious target, but it is definitely achievable.
So how are you today, Brody?
Pretty good.
Done any homework?
No.
No.
But here in Tauranga it has been hovering around, 90% for about the last 5 years.
88% I think at the moment, but we've come from a long way further back than many other DHBs in New Zealand or communities in New Zealand. So we've made very good progress, but we've just got to make that little bit extra to really get to where we need to be.
What has been the obstacle?
Well, I think a lot of it is children not being immunised on time. Most people are keen to get their children immunised, but it's important that they actually do it when it needs to be done, to provide their children with the best protection.
On time and every time?
On time and every time. So this is little Evie.
It is, yeah.
She's how old now?
She's 12 weeks.
12 weeks.
Yeah.
So she's just been to have a 3-month vaccination?
She has,
yeah.
yes.
Okay,
yeah.
how did that go?
Good, yeah. She was good. I mean, she cried, but it's okay. It's all
Yeah.
for the greater good.
Yeah. The more infectious a disease is, the higher the number of, or percentage of the population you need to be vaccinated to protect against it. And measles, for instance, which is one of the most infectious diseases of all, you really need to be up near that 95% to provide protection.
We seem to be immune to this sort of thought that measles is a dreadful disease. Is it a nasty disease?
It is a very miserable disease. One of the things that characterises children with measles is that they are miserable. I personally have looked after children with measles and encephalitis, so that's where it's affected the brain, and that's a very frightening illness to see a child with.
Do we see loss of life?
We do from time. There are deaths from some of these conditions. Obviously they're not common, but the aim of immunisation is not just prevention of death, but also prevention of serious illness and distress.